Q&A session. So some of you, when you registered, actually submitted questions. I'm going to be asking some of those. During the event itself, if you have more questions, feel free to put them into the chat, and I'll try to monitor that and ask those as well. The other option would be that you can actually ask them live. So you're free to unmute yourself and also show your video, and you can ask the speaker directly as well. But until we get to that point, it would be great if everyone could stay muted, and also feel free to keep your video off so that we can save on bandwidth. In the chat, if you didn't quite get the website I talked about earlier, is the website to our office, and we'll share all the different programs and the deadlines that are coming up. Right, so great. I am now delighted to turn everything over to Dr. Angelique Johnson. So please, it's yours.
Wonderful. So I'm glad to be here. And yeah, Ella's definitely, as I call her, the queen of memes. As a student, she was just always, you know, brilliant genius. I think she was the first like engineer I met that was like extremely brilliant, but also extremely nice and just like compassionate, like had a human soul, you know, that was like above me at that level. So, and continue to inspire me as well. In fact, little known fact, I had applied for some funding for my business right out of being a graduate student. I wasn't as brave as she said, because I got declined from the NIH for like an SBIR. And I was like, oh, this is miserable. And then I ran into Ellis at some random meeting in Ohio. I don't remember what it was. And she was like, oh yeah, I got denied too one time. And I went home, I was like, oh, okay, I guess I can apply again. It's like, you know, like Ellis men got denied. Okay. And she said she applied again, then I should apply again. So yeah, I don't think I would have ever applied again if I hadn't realized like, oh, okay, failure's not the end of it. Like you can apply again and get it. So I'm just going to give you guys a really quick, because I don't want to spend too much time on this, but I'm going to share my screen and just give you guys kind of a little bit about innovation, and then also a little bit about, you know, my journey. And so let me go ahead and hopefully share that. Cool, wonderful. So my company is MemStim, and we do, as I'll explain through the slide, neurostimulator leads, so for all sorts of indications. But before I launch into that, I kind of want to talk about, just briefly, about the concept of thinking like an innovator, but acting like an entrepreneur, and where not doing this can go terribly awry in your journey on either one of those lanes, actually. So innovators, you know, if you think of academics, innovators is what you're thinking of. I'm sure majority, if not everybody on this, in this meeting is an innovator. And from an academic perspective, innovators, they just want to innovate. They just love innovating, and they will innovate anything. It's like a hamster running in their brain. It doesn't matter if it has a purpose or an end goal or not in terms of like making the marketplace or even being used in human beings or being used for human beings. It's just, they're just in love with innovating. So they're basically making a better mousetrap. You know, they don't even care if it catches mice. They just want to make a better one. On the other side, you know, you have entrepreneurs, and entrepreneurs, they just think about money all day long. So they're always, you know, just, you know, trying to grab money, trying to be profitable. And they don't care if that what they're doing has no purpose as well. So they both have that in common. But what you end up happening is, what you end up seeing as a result of this is that you end up with science and innovative technologies in the university setting that make wonderful covers of, you know, this is super old, but you know, these kind of, oh, we're 3D printing a heart now. And, you know, we're not really 3D printing a heart. We might be 3D printing some graft that might, you know, or something in a Petri dish, but we're not quite to the full heart. So you end up with these wonderful, great opportunities that are coming out of the innovators' labs, but we don't actually see them hit the marketplace. And it's not always that we can't make them hit the marketplace. It's just, as I'll talk later in my slide, there's no intersection between the innovator and the entrepreneur. On the flip side, you have entrepreneurs, and they love to make money. And so they make, you know, things like fidget spinners that make lots of money, but have no purpose, and they're not really needed in society. I mean, I know that there's some calming effect and that they do have some indications of use, you know, later on down the road. But really, when we're talking about artificial heart or fidget spinner, one obviously is one that we would rather have in the world if we had to choose between the two of them. So entrepreneurs, they could care less about some greater good in the world. It's just about making money. And innovators, sometimes they do care about a greater good, but they're not thinking enough about making money. And so it just stays in their head or it stays in the lab and they don't get it to the marketplace. So I gave that little bit of a kind of a segue because I came out of a university lab and I thought like an innovator and I had to learn, you know, how to act like an entrepreneur through the process. And because of that, I had a lot of misadventures being an innovator and trying to start my own company. And so along that lines, I kind of give you the short of my journey. My dissertation was in cochlear implants, and cochlear implants are, you know, for lack of a better term, implantable hearing aids, although technically that's an entirely different device. But in layman's terms, think of a hearing aid that you implant, and it's for sensory neural hearing loss. So basically, you are taking a sound processor, which looks like a little Bluetooth device on the external, and is processing sound and creating a digital code for that, and a series of analog signals that end up coming out of the implanted pulse generator go to the electrode lead, which is implanted inside the cochlea. What I was doing for my dissertation work was focusing on the electrode lead and how do we add many more electrodes, because at that time the thought was more electrodes, you get a higher resolution of sound. Now in this pursuit, we had a really great, I mean, it was top notch, you know, micro fabricated, you know, wonderful system. We had a thin film cochlear electrode array that had 32 electrode sites that were almost half the size of a standard cochlear implant electrode, super high density. We had a custom ASIC that I designed and created as part of my dissertation work that was going to basically multiplex those 32 sites, which the 32 sites, by the way, was just one demo part of what was eventually going to be 128 electrode sites. So we need a local multiplexer on that. And then it was going to be connected to a stimulator chip that was going to be custom. Another group was working on that through a cabling system, an 8-lead cable, so that we could get our data and all of our command codes to the ASIC and then ultimately stimulate. So this was, I mean, this sounds really great. It was going to be really small and, you know, and all this wonderful, great stuff. And we had rings, you know, when we got fancy with it, you know, we put some rings on the back of the electrode array so that you could put a stylet wire through it. Why would you want a stylet wire? Well, the cochlea is spiraled, and we would actually pre-shape using different bimetallic, you know, thin film coated metals to make spiral shapes so that it could hug the cochlea, but we need a stylet to make it straight enough to actually start the insertion process. So we had Parylene rings doing all kinds of deep reactive ion etching and molding and back etching out from the backside of a wafer and all this stuff that sounds really great and wonderful when you're in microfab land in the university and, you know, doing again custom ASICs and integrating the two and of course the, you know, adding, I mean, we even moved on and we're doing elastic, you know, semi-elastic traces by electroplating platinum on silicone and then doing thin film metals like platinum on silicone that was pre-stretched when you deposit it. So we were doing all this wonderful stuff, and in addition to all the technological things that we were doing, innovations, we were also doing, of course, animal studies. So we're using guinea pigs and cat models to basically test the functionality of our technology. You know, cochlea going into the array going to the cochlea, and then we had another neural probe recording from the brain in the inferior colliculus, and it was all great. It was all wonderful, and I thought it was all commercializable because hey, it had all these great features that we were going to save the world with. But when it came time to pitch this in a business plan competition, which was my first foray into the entrepreneurial world. So I definitely love that, you know, the school is holding a pitch competition for undergrads because it's a great way to learn by doing instead of just kind of maybe taking lectures or watching Google videos. Well, I did a pitch competition and my first kind of knock in the face was taking my dissertation work down to the business school and them telling me that you can't commercialize what you're doing, which I, as an innovator, didn't understand because I thought, wait a minute, we're going to have like high resolution, you know, sound for people never heard before, and we're going to do this and do that. And they just kept saying, like, we've heard this before in terms of microfabricated implants, and it never goes anywhere. And I didn't understand for the longest time why. But I was glad that after several weeks of hearing that and then talking to people in the business sector, I finally understood that I had an innovation, but I didn't have a marketable product. And so the competition really was my first go at making a business plan and making a marketable product out of somewhat out of the innovations I had done in the lab. And in this picture, I had two MBA students. I was an engineer, and at Michigan, and you might have the same thing at USC, we had this collaboration with the business school. So you kind of go down to business school and get a couple MBA students, and you form a pseudo company and you pitch it. Well, the company pitched it really well. We traveled Texas and California and traveled around and continued to pitch the idea and got a lot of feedback. And it seemed like a really great business idea. And I had prototypes after all that we had tested in animals. So I thought we were ready to go. So we took our idea, this is in 2010, I think maybe towards the end of 2010, we took our idea and we went to Advanced Bionics headquarters, which by the way, we only got into because through a cold call. So people wanted the technology bad enough that I literally just called a 1-800 number at Advanced Bionics because we had no contacts with that company and just left a voicemail and just said, hey, I'm making this company doing microfabricated electrode leads and here's the benefits. And I ended up getting an email back from the vice president of innovation over their lead division. And he said, hey, can you guys come, to California? Let's see what you guys have. So we were really excited. We thought, oh, wow, they really want this. And we got there, but it did not go as we had hoped. It was a great learning experience, which if anyone has any questions about how do you have those meetings with strategic corporate partners, but access was absolutely denied to our technology, primarily because we had created in the lab something that was functional, something that could be used in animals, but two things that happened in that meeting. One, I learned that just because it worked in the lab didn't mean it was suitable for the marketplace. I hadn't thought of packaging with my technology. I just thought, was it functional? The other thing was they seemed to actually not really give two flips about our animal data, which surprised me because I thought, how else would we test it? And they were more interested in, had you put it in, human cadavers, which we had not ever thought to do because we were trying to push the limits of performance. And they said, animals are great, but animals don't help us with FDA. And we need to know, how does this thing perform when you put it in a human? Is it gonna damage the ear? You need to tell us, do dissections, what's the longevity of the materials? We hadn't done any of that. We had just, I spent my, years in dissertation just trying to get it to work. So I thought it was really great. And as a result of this, I was quickly on my way to the valley of death, which many of you probably know, but basically you see this a lot with university spin out technologies. The innovator is really excited about it and they go to commercialize it. And the technology basically dies out, the company dies out in this development phase between a concept in a lab and actual commercialization on the marketplace. And the reason this valley of death exists, as far as I am concerned, this is my personal opinion, just having looked at and studied and just talked, both on the corporate side and on the academic side, is because going back to my original point, you have innovators who innovated to make something have the best performance, and then you have commercialized markets, right? Commercialization markets and corporate entities and even existing hospital systems that say, it's not just about how great something works, it's, can I actually use it? Can human beings use it? Can they, if it's a medical device, can it survive in the body? Will the FDA approve it? Is it durable enough? Does it have the right packaging? All of these things become primary concerns to the commercialization side that, and in many cases, we don't even think about. We write a little paragraph here or there, something in a paper, maybe not a sentence in a paper, maybe a paragraph somewhere to say like, oh, wait, a lot of hand waving, but there's no hand waving on the marketplace. It either is something that people are going to get value out of in terms of being able to use it or not. So with that being said, I was heading there steadily, and I was kind of stuck in this staircase. Had done really well in the laboratory, but I was nowhere near a pilot plant scale up at this point. And I wanted to get to commercial manufacturing. That's where I wanted to end up. And so I was kind of saying, okay, can I do this still? Now, I would love to say that I was like, oh, okay, got turned down from that. Let's get right into, making MemStim. But for me, I was like, I don't know if I even want to do MemStim. I mean, this is going to be, I'm going to have to redo everything, and this, we have to really rethink this technology. So from about 2011 to about 2014, I was in the entrepreneurial, I would say, gray zone. Wasn't what, me and my company weren't really in a serious relationship. It was kind of an in the meantime boo. We would basically, get together whenever I had spare time. But I actually did a postdoc for 2 years, and then I went to work for university and be a research scientist at a university for another year. But the thing that pushed me back into the company to actually go full force with it was that we still had potential customers that would reach out, and even some potential investors that would reach out and say, hey, are you guys moving this forward? I heard about it like a few years back, was wondering if there's any updates or what's going on. And that, and the fact that I realized academic world wasn't for me, and I really did I wanted to create something that would actually be used inside of a human body, in the near future. And again, the academic world, at least at that time, was very heavily focused on the innovation so much that it was even hard to get a grant, an R01 grant that was going to be not applied, isn't even the word, applicable, which is related to the word, but actually something that you can put out in the marketplace, so commercializable basically, versus just applied. And so what I did was, at this point, so this is like 2014 or so, tail end of that, I said, okay, let's go back and let's rethink this innovation thing. I'm sitting in the lab. I'm a company of one. I'm like, okay, I'm going to start this. And I'm back in the lab. And it occurred to me that I was going out of my way, because it was how I was trained from a university setting. I was going out of my way to use all of these expensive, high-tech tools that were complicated. And I was avoiding things that maybe weren't paper worthy, but actually were better for the commercialization of my technology. And in a crazy way, when I said, well, let me go back. If I didn't know anything about microfabrication, how would I make this? What would I do with it? And I also started talking to other entrepreneurs, and I found that a lot of, at least in my field, is microfabrication, MEMS, nanotechnology. I started finding that a lot of companies that had spun out their technology and actually had made it successfully through commercialization, that they themselves had abandoned the microfab tool set and had moved to a more traditional tool set to create the same device in a way. And so I started looking at that and thinking about innovating on demand, and not just innovating because I could and because it was interesting. That actually led me to also think about the application areas for the technology, and think about what were the real challenges. Before, with cochlear implants, I had always thought about increasing the performance. And I didn't understand, like I said at the time, when people kept saying, well, that's not a business. And what I ended up, through that whole pitching process, and then even further on, I did the NSF Core program. That was really when it kind of, really hit home that I wasn't making an electrode lead company per se. I was a manufacturing company, and that manufacturing was actually my product. And I could produce the same exact lead that is used in devices like cochlear implants, spinal cord stimulators for chronic pain, epileptic vagus nerve stimulators for epilepsy, and deep brain stimulators for Parkinson's tremors. I could create those same leads. They could have the exact same design of the existing devices, but I could offer a much cheaper, much more flexible manufacturing process using some of the advanced techniques along with traditional techniques. And so we really became more of a original equipment manufacturer, became our business model, versus coming out with our own product that was going to be so wildly crazy and great, because we talked to so many players in the space And the one thing they kept saying is, we've been wanting to do MEMS leads for decades, and we've been working on it for decades, but we can't figure out how to make a automated manufacturing process that will produce a lead, a neurostimulator that's actually durable enough for human use long term, and that can withstand the current levels that you need in the body long term, and that the surgeon is compatible with surgical techniques that are currently being used or could be used in the future. So really, it came down to hand assembly was the primary problem. Right now, all of the leads that are produced by neurostimulator companies like Medtronic and Boston Scientific and Abbott, Cochlear Limited, Advanced Bionics, and the like, that's literally a floor full of individuals who are looking under a microscope and micro welding 25 micron wide, diameter wide wires, platinum iridium wires, to, in some cases, 400 micron square platinum foil pieces. And that's a very tedious process. It's labor intensive. It's hard to get really good yield out of that. That leads to recalls in the marketplace. Spinal cord stimulators, in some cases, have had up to 47% of the leads fail due to fracture over time. Even in cochlear implants, they're seeing a lot of lead fracture and failure as the data is coming in, because that's still a relatively newer device, but it actually stays in the longest of all devices. And you're restricting future innovations. You can only build what the human hand can manipulate. But if you look at, and here's an example, if you're looking at this, this is kind of just a close-up, and you all know this. Sometimes I show this to audiences that aren't very tech focused. So you all know what it is to sit in the lab with a pair of tweezers, looking under a light, under a microscope, and trying to get, just please, dear God, just one of these devices. If it could work, I can graduate. If it'll work, I can get this paper. If it'll work, we got some preliminary data for a grant. But in the commercial marketplace, that is not good enough. So that's the last thing they want. So they spend so much time training these techs so that because they're going through the same thing that you would go through if you were making this in your lab. They don't have anything fancier than you have. And so they spend a lot of time training technicians to do this and then testing it. And they do have these failure rates that aren't that great for what they're doing, especially when you think about medical devices and the cost. So what we do is we do automation. We use a combination of microfabrication and 3D printing or additive manufacturing to produce the devices. So now, instead of having a floor full of personnel, you can use automated machining to basically do many, many devices at a time, but without having one person for every individual device. Because the previous process was one person per device throughput when you got to the majority of the stages. But with us, it's one person that could turn out, hundreds of devices, and we can certainly do, 50, 60 devices at a time with just one person. The other thing is it also reduces cost. So it lends itself towards batch fabrication as well as reducing the labor cost, and enables innovation. Again, we did not set out to innovate. We just knew that microfabrication suffered from not being durable enough to survive in the body. When we moved to printing only because we wanted to create durable metal that was, and one of the requirements was it had to elongate. And so we said, wouldn't it be great if we could just make elastic metal and we wouldn't have to worry more about this, meandering traces and, trying to vapor deposit on pre-stretched, elastic substrates and all this stuff we were trying to do in our high-tech innovative best that was not very reliable in terms of yield. So we just created elastic metal. So we started making conductive silicones and printing them out to make electrode arrays for the cochlear implant space. And now we're actually starting to apply them to other spaces as well with the 3D printing solution. So these leads are elastic, which means they're fracture resistant. That's a big problem. Again, as I stated, in the space, they're stretchable, they're body compliant. So you could make these leads as surface electrodes, using them as ECOG electrodes. So, it's almost like saran wrap effect that can happen with them. They're body compliant in terms of moving with the body because there's no rigid components in the technology. It's all soft, elastomeric materials. We can make them thin, so we still get the thin benefits of microfabrication. So we can still put down very thin layers, but at the same time, we're able to do it in a durable way. So because they're thin, they can be minimally invasive. We can roll them up and insert these things through a needle. If you're thinking about getting it into the brain or you're thinking about getting it into the spine, they're tissue compliant. With some of you might be in the field of bioelectronics and understand that the desire to have a technology that mimics the tissue as much as possible, and of course conformable. And then dense leads, so we can do, compact, lots of electrodes, lots of sites, thin traces, and which helps with efficient charge transfer and doing, broader arrays of electrodes. And then the last thing is weldless. In the beginning, if you remember, there's a picture of somebody kind of like welding, and all you see was their hands. Well, that welding process is a huge barrier in the space in terms of making these leads. It's actually the most critical part of it. And so we said, hey, why don't we just get rid of that? And what if you could just plug our devices straight onto the connector pins, the hermetically sealed connector pins, and then just seal it up. And so that's something that we call plug and play that we're using now to be compatible with the current stimulators for assembly. And all of this, of course, leads us to generate more and more intellectual property. We, in many cases, actually in all cases, but we don't know if you ever come back to them, but we basically we had one set of patents that through the University of Michigan that we thought was going to be the technology. And now, after going back and re-innovating the whole process, we now have a whole new set of patents. And those are the ones that are actually, it's going to be the future of our technology. So it's along the way, it's still that building that IP portfolio. So I guess I'll stop there and kind of lean into the fireside chat.
All right, great. Well, now everyone has a sense of what you're doing and some of the struggles that innovators, entrepreneurs, I guess in your case, it's both, right, had to go through to get to where you are today. So I want to start off maybe going back a bit earlier, rewinding the clock to before you finished up grad school and you started your company, and talk about the influences that led you to the point to want to become an innovator / entrepreneur. So do you have early influences, maybe even before undergrad, that led you to this point?
Yeah. So both my parents were in STEM. My mom, she got her degree in mathematics, and she was one of the earliest coders. She was working, I think, at General Electric, I think, or something like that, back in the punch card days. But my mom, she was also, because of her generation, when she got married to my dad, who was a chemical engineer, and then he later went on to get to environmental engineering degree. She stopped working as soon as she had kids, and she had good reason, because I have 5 brothers and 5 sisters, so there's 11 of us total. So she basically dedicated her life to not only raising us, but actually teaching us. So before, I guess, NTI was a thing, we were homeschooled. But in that homeschooling process, she was always putting us in robotics camps. I had to do math camp, which at first I was like, math camp, but then I actually really liked it because it wasn't calculus, it wasn't algebra, which was fine too, but it was more math theory, which is more like game. So that was really nice. Like brain teasers, pretty much, is what it felt like, although it was advanced math classes. So that my interest was always in STEM, and for some weird reason, from a young age too, I was really intrigued by this perhaps cyborg concept of mixing technology and the human nervous system, and amplifying what was already there, or healing people in ways that pharmaceuticals couldn't.
So did you decide on that field already as an undergraduate, or did that sort of happen over time as you were exposed to more and more engineering topics?
Yeah, I just knew. I started as undergraduate as a math major, probably because of my mom's influence. And then I think halfway through my first semester, I got a taste of computer science, and I was like, okay, I don't want to do math anymore. Computer science is where it's at. But I'm always wanting to know the most about something. So I said, let me do computer engineering because I'll get a little both. So but I didn't know, I knew I didn't want to make computers, if that makes any sense. I loved computer engineering. I had no interest in making computers. I was still chasing for this medical situation. And so I did research at Johns Hopkins with Nitish Thakor for a little bit in his lab, and then being able to go to Caltech and do research under Ellis. That was, working with, I think at the time I was working with neural cages. and just seeing, went to MIT in their brain and cognitive science department. So to me, actually, it was all those internships. Went to Case Western in their functional electrical stimulation area. And so it was all of those summer internships during undergrad that exposed me to the world of mixing tech in the nervous system. And it wasn't until, I mean, it wasn't actually until I had to sit down and pick an advisor in grad school that I knew I was going to go into MEMS and microfab. And it wasn't till the year of my dissertation that I knew it was going to, that I thought about starting a company. It wasn't 4 years after that that I knew I was going to actually carry this company forward. So it was a slow progression for me, but I think that's the way maybe it is for most.
Yeah, so you kind of took doors as they became open to you throughout your career, and I think took every advantage of all the opportunities presented. So I just want to encourage the audience, you're free to ask questions in the chat or indicate that you have a question by raising your hand. I'm happy to help moderate those. I do have a long list of questions that have come in from the participants, as well as ones that I've kind of warned Angelique ahead of time that I might ask. So we do have a lot of students from undergraduate to graduate. There might even be a few postdocs in the mix as well. I'm curious, what would you tell yourself maybe to have done differently, or things have taken advantage of, if you were your undergrad self again, or if you were your grad self again, or right after when you started to become an entrepreneur? What things did you wish you knew, or programs that you wish you could have taken more advantage of in those settings?
Yeah. I wish, I don't know that I would have done much different in undergrad, because I think that was just about trying to figure out what I was doing. But what I would have, what I would have done in terms of an entrepreneurial perspective, I would have started thinking about how I was going to commercialize the technology. Even if I never wanted to start my own company, I would have started thinking about, because I always wanted it to be in the human body, but I never thought about the commercialization process until the last year. And that's kind of counterintuitive. Like, we make all this technology, we want people to use it, and we never think about how it'll get there. So I would go back and tell that younger first year graduate student, when you pick a research topic, if you in your lifetime want to see it utilized by human beings in some capacity, then push yourself, push your advisor to think about, especially if you're in the applied space, of course. Theory doesn't really, it's not the same, but push yourself, push your advisor to say, but how would we make this, and who would buy it, and what would we need to have in order for them to buy it? That's what I would have done, because I could have, I would just save so much time. It just and then on somebody else's time, could have done it on somebody else's time too. Someone else is paying for your, research. It feels like a slave labor, but somebody's still paying for it. But as a startup founder, you got to find the money yourself.
Right. So actually, so as a graduate student, you did find Ken, and Ken is one of the legends and one of the pioneers in the field. So I think it's so wonderful for you, I think, to be able to have worked with him and receive the benefit of his advice. And I've encountered him multiple times over the years. He's now retired. But interesting. I mean, you kind of see yourself telling Ken, hey, you should think more about this stuff.
Yeah, we should think more about how he was surprisingly hands-off. I mean, he was there when he was like, I got him at the retirement years. So it was like, I think all the younger kids got all the older kids got the bad treatment, and I kind of got okay, whatever you want to do.
So many students, or many participants, really have a lot of questions about, getting funding, what it's like to find co-founders, all the different nuts and bolts to actually starting up. And it sounds like you were doing a lot of that learning as you were going through that, and pretty late, right? Pretty late into your PhD process, you finally made the decision you're gonna do it, and you kind of just jumped right in. So can you talk about, the process of raising funding and finding those MBA students to help you out? Who kind of stuck around, who didn't stick around?
Yeah. So there's, primary funding is, you can either do venture capital or some sort of private equity or angel investor. So that's people taking their money or somebody else's money and investing in your company, and then they want some return. So they invest in your company and they hope 3 to 5 years, whatever their terms are, that they get out some major multiple of the money. They want the money to grow. which means that your company needs to be sold to somebody else, or you need to go public. And we actually been seeing more IPOs recently. When I was coming up, it was like, you're never going to have an IPO. We're certainly not going to have an IPO because in our space you don't see them, but in other spaces. So there's that, and then there's the grant route, and that's the route that we end up taking, which is SBIR grants. Is really good money if you can get it, because it doesn't dilute your company. It allows you to do like we did. We had to totally redo our whole technology, and no investor was going to pay us. We can't go to an investor and say like, hey, what we made didn't work. Can you give us money to like totally redo everything? That wasn't even an option, right? So the SBIR is Small Business Innovation Research Grant and Innovation Research. So it's a grant, so you can do R&D to get to the development phase. So then you're at a position, if you want, to take on an investor or to do a strategic partnership. The other way is, I guess they say friends and family. So before you get too far into it and you just want to start out, for me, I didn't have friends and family that had money like that, so that was never going to be an option. So I didn't even think about that. That wasn't even in my mind at all. But I really have benefited. I've done maybe about 5 million in grants over, I think between 2000. I think we got our first one in 2015. And recently got another one. So we've done about 5 million between the federal grants and then matching funds to the state of Kentucky. That's why we're here. And then as well as other sources, non-dilutive sources. So that, getting that money was a journey, a process. And now we're kind of reaching the phase where we'll probably have to take on investment, because in order to really scale, you need a large amount of money to be able to do that fast.
So you brought up moving to Kentucky, and I think that there's some very good reasons to have done that, because you started out in Ann Arbor, basically near the Michigan campus, right? And then moved away from that. And so can you talk about the decision to move to Kentucky and what benefits that brought?
So I get the benefit of money, and that's great. And the cost of living here is much cheaper than Ann Arbor, Michigan, which doesn't make sense, but this is a bigger city, but the cost of living is cheaper. Now that's important for me, because that means that the salaries that I have to pay my employees isn't the East Coast or even the Ann Arbor salaries, where you have like a plethora of doctors and MDs and lawyers, and and so the salaries there are much higher, even in Michigan. But then talking about the coast, the salaries are much higher. So the benefit is that. The disadvantage is talent. When I was at Michigan, I just thought, you couldn't turn around without bumping into somebody that you could hire for your company. I had, the training of the students was really good there. I had a lot of graduate students there, and they had a lot of staff members that did moonlighting. So you could always get a contractor. In Louisville, Kentucky, that's not the case at all. Like, they have wonderful facilities here. That's another advantage. They have, because the government is always trying to build advanced manufacturing in regions like, these tech droughts, like the Kentucky region and Indiana and Ohio. They end up getting these beautiful facilities that are underutilized. So that's good for us. Maybe not good for them, but it's good for us, because we basically become their primary customer. And so it's different than at Michigan or a place where there's more usage, where you're having to come in at 3 o'clock in the morning to get something done. Here, you just come in and do it. So that's another advantage. But getting access to talent, that's really a key part of a business. And that we have to really work at. And we have to even, breed our own talent. Like, we actually have to train. We are much more open to training people to do what we want them to do, versus expecting somebody just to show up in our door with all the skill sets.
All right, so we have a question from the audience, and so I'm going to call on Jacqueline. Hopefully I pronounced her name correctly.
Hi, yeah, Jacqueline. Thank you for the talk. That was really interesting. I had a couple questions. First, I was curious about like what kind of lab space you used when you were building this stuff. Like, were you at a university at this point, and were they like okay with you using the lab space for your own company, or like did your funders provide you a lab? Or I was curious about that.
So when the beauty of being a university startup is you have access. You're still like cousins to your faculty, either your advisor or sister or brother labs. So you have access to the labs even after you graduate, because you have
Very
those
cool.
social capital connections. And the way that Michigan worked with the microfab facilities, I'm sure it's the same thing at USC, it's the same thing, they have external users. So, you don't get the friends and family rate. So you don't get the subsidized rate that faculty would get. You have to pay the commercial rate, which is an X factor above it, but you can still use the facilities and get it done. You don't have to build out your own. So we did that for many years. Even when we moved here to Louisville, the only reason that Louisville was even viable is because they had a really great microfab facility, like I said, that was underutilized. But at some point, we can't control that facility. In other words, to have regulatory controls in place, good manufacturing practices, we can't do that in a university lab. And so now we have our own small lab that we built out and we'll go to the university lab if it's a tool that we don't want to purchase and say it's just cheaper just to go there once or twice a year if we're going to use it. But the university labs, it's really hard for entrepreneurs that think of a tech idea, like something that's definitely in the hard science, that is not connected to university, because it's harder for them to get into the lab, because even the universities have the incubator labs. So if you're a spin out of a university, almost all of them now have you can come in a shared lab that we have just for startups. So there's a lot, but if you're not affiliated with the university or you don't have the connections or ties, then it becomes really hard. But you guys have a really great advantage in that university connection.
Oh, very cool. Okay, I didn't even know those connections existed. That's neat. I had a question also about with time frame. And so I don't know, at least in my PhD so far, there's not a whole lot of deadlines or there's a lot of internal deadlines that I have to set for myself to make sure I keep going. And so what is the pace like in entrepreneurship?
Somebody I think had asked on one of the questions, what about a PhD could prepare them for the startup world? And the fact that you don't have deadlines, you have to make your own, is great practice. Because if you were to start your own company and be founder of your own company and be CEO of your own company, there's nobody, there might be investors breathing down your neck that want results, but no one's going to give you the milestone. So I learned so much in going through the PhD process on how to independently manage a project. My advisor, again, because he was retiring, he was very hands-off, so he just, he was just there for wisdom and advice, but he didn't micromanage us. So that's actually the best way, because you're learning now how to build a team and also being observant of what your advisor did. Because as a startup now, I'm building a team. We have to build out a lab. If I hadn't gotten a PhD, I couldn't imagine, or I hire PhDs. So we have 3 other PhDs here now. And so I couldn't imagine, or 2 other PhDs, I couldn't imagine trying to train somebody who didn't come from that. How do you build out a lab? It would seem because contractors pay a lot to do that, because they're well, we're going to charge you hundreds of thousands of dollars. And I'm no, I don't think we're going to do that. We just hit up good old Fisher's eye and, get it done. So you learn so much you really do learn a lot about the emotional aptitude that it takes to do a startup when you're going through the PhD process.
Very cool. Thank you.
Okay. You answered the question I was going to ask next, because I think we were leading into that. So that's perfect. Again, if there are others that want to ask questions, raise your hand in some way so that we can do this in a orderly fashion. Otherwise, I have lots of other questions that we can go through as well. So, you're doing a lot in terms of mentoring other founders now. And I think a piece of this other startup company that you created is actually to do that. And so can you talk about a little bit about what you're doing to kind of give back and maybe help others avoid some of the misadventures you talked about early on?
Yeah, so I started doing mentoring programs, incubator and accelerator programs for particularly entrepreneurs of color, because I was seeing that even outside the tech space, there was a real kind of, vacuum in that space, especially here in Louisville, Kentucky, because again, it's, Kentucky is one of those regions where there is a lot of racial divide, but you see it everywhere. And so I started doing incubator and accelerator programs, and it was just kind of an outreach effort that MemSip would do. We had one of our, on our mission statement, one of our pillars is that we have to have a greater good and do good. And since we're not in the clinical space yet, that pillar's not satisfied. So we said, why don't we do some outreach? That could be our way of, improving and giving out. Well, it got to the point where it was like, I think we need a company actually to manage that. And really to do that in a much better way. So I created Visionarium, which is really just a play on millionaire. We call them visionaires, and the visionaries where you just breed visionaires, and visionaires are just vision-rich individuals like yourself that know how to execute or looking to learn how to execute. And so we also even outside of Visionarium on a national level, I'm a part of an organization called MedTech Color, and we actually have a pitch competition for Black and Latinx founders that are in the healthcare space. You can be on the software side, you can be on the hardware side, you can be implants. The gamut is pretty broad, and I'll drop the link in the chat during this, and February 5th is the deadline to apply, so please do apply. We're giving out over $100,000 in cash prizes. I think we're spread out over a couple of different levels, 1, 2, and 3 levels. But even more important than the money, which is great, and that's why we wanted to give it out, is the competition's actually in collaboration with Johnson & Johnson and ResMed, and even bringing on some other big players soon. And so there's the opportunity to, in a sense, be incubated inside of those larger corporations, which Johnson & Johnson has J Labs, but they don't particularly go outside of J Labs, but they actually are working with us to create, what I'm calling J Labs Light. And I don't know if they would agree with me using that term or not. So sorry, Johnson & Johnson, somebody's starting to see that. But basically they're going to have Johnson & Johnson commercialization people come train the top 10 finalists of this competition. And then those finalists will then have access to the inside of Johnson & Johnson. And really that's something when you're building your company out, especially if it's in the tech space, if you want to understand what the large players are doing in terms of how they operate. And the only way to do that is to get on the inside, and they will never let you on the inside. And so we really wanted to push to say, hey, let's get some of these companies in on the inside. Why don't wait till they get to a certain stage and then invest in them, Johnson & Johnson. Why don't you, and since I have a heart for it, why don't you invest in them at the early stage and bring them up in the ecosystem? And so it's a really great opportunity to do that. So I do a lot of pitch competitions around that kind of scope.
Wonderful. So I think there's so many challenges that one faces when you're an entrepreneur. And I think that depending on your lived experiences and where you come from, they can take on different forms. And so one question that was put in by the participants, I feel is important to ask. They're asking, have you ever felt imposter syndrome as a female engineer or startup founder, and how did you deal with it? And I think especially in this time when there's so many challenges around the world, having the courage and resilience to get through those is really important. So it would be wonderful if you could share some of your advice.
Yeah, I absolutely. I mean, all through graduate school, it was so terrible. I mean, it was really bad. Imposter syndrome wasn't something I conquered until probably a few years ago. And, in grad school, being the only woman in a lot of spaces, or being only one of a handful of women, being the only African-American female. I think I'm like the third African-American woman to ever graduate with her Ph.D. in electrical engineering from University of Michigan, and Michigan's a pretty old institution. So, so just being that, and I think I'm the last one to graduate before me was like 20 years, ago, from the time that I had graduated. So that was really a really hard time for me, just not knowing could I do it. And the first thing that happened that really helped me knock through that imposter syndrome was I started listening to people. So I always advise people, if you have imposter syndrome, stop listening to your own head and just start listening to people. And when I say listening to people, I mean, just when you go to lunch, when you're in the lab, when you're around your colleagues, just listen. And I used to think people were so smart, so much smarter than me. And then I realized they were just reciting the same facts. And my imposter syndrome got so bad, I was even had imposter syndrome about, well, I don't know, world events. They're always talking about world events at the lunch table. And, how do they know all this stuff? They're just so worldly and knowledgeable. Like, it was really bad. Like, I was way outside tech. And then I remember I started listening to NPR, and then I went to the lunch table. I was like, you're just reciting what you guys heard on the morning show. Like they're just reciting what they heard on NPR. Like they had no new facts. They had no new information to add. It wasn't even insightful commentary. It was just a lot of hot air blown around the lunch table. So I think listen. If you listen, the people that you think are so much greater than you, they're just humans, and we're all humans. And that to me really helps. And the last thing is, you can't have imposter syndrome if you have a foundation in who you are and where your value comes from. I am also a minister in my church, and I think that's really when I was like, wait a minute. So if I know who I am in God, like who I'm in Christ, and I have that inherent value, then how could I, like, when I walk in the room, everybody should just be blessed that I'm there because I have a purpose to be in the room, right? Like, I may not even know what that purpose is, but there's a greater purpose. And so now when I walk in the room, it's kind of exciting because I'm thinking, what's going to happen here? Like this, something could happen here. Like this, like I add value when I walk into the room. I don't know what it is. And it's almost now again, like, what's the value I'm going to add in this room? And then someone comes talk to me, like, oh, that's the value. I was able to feed back to somebody. I was able to, talk to someone, I had a conversation with somebody. So, just knowing, know what value you have, value yourself truly without all the accomplishments and the credentials. And that will really help with imposter syndrome.
I think that's fantastic advice. So we are near the end of our time. I want to point out that Angelique has shared the link to the program that she just mentioned. And before we wrap up, I want to give her the opportunity to have the last word. So if you have maybe a one-word advice or a phrase or anything else you'd like to say to the audience, what would that be?
We may not all be millionaires, but we can all be visionaries. So stay vision rich and execution thick.
Well, thank you. Everyone, please join me in thanking Dr. Johnson for joining us and spending some time with us today. We really appreciate the time. Wish you all the best as you continue on your adventures. And hopefully there are good adventures, not misadventures. And we hope to be hearing more about MEMSTEM and Visionarium in the future. Thank you.
Okay, thank you. Bye.
Bye-bye.